How will I know if a fertility supplement is working? I'm not sure I even took it long enough. Yeah, it's tricky, right? Especially when, if you've just seen it like as a general suggestion, like take this elixir, this fertility tea, and you'll get pregnant, right? We've all seen those ads online constantly. As soon as you click on one, especially, you'll get hundreds of them. I know. So this is a question of certainty. How do I know if something's working, right? Everybody wants certainty. I cannot offer certainty in certain ways. I can offer certainty in other ways. So if we start taking something or doing something, let's open this up from just like a supplement or a tea, which I think was in her case. Let's back it up and substitute any word you want, like anything you've tried for fertility, right? A hot pack, castor oil packs, like anything that you've tried or read is good for fertility. How do I know if it's working? And how do I know how long to do it for? I mean, this is ultimately a question of looking for certainty, which it does not really exist. But what we can do is we can learn to measure feedback from our body, and that we can get some certainty by reading the clues and the cues from our body to tell us if something's working, what's changing, and then to be able to understand even how long to do something for, or to take something for in this case, before you don't need it anymore. Because that's the goal for us, at least in natural medicine and in Eastern medicine especially, is not to have you take things forever. We want to have you take less, right? I make your supplement pile smaller when you work with me. So we don't want to just take everything you've ever heard of indefinitely and then hope it's working, because that's exactly like the question. You will get to a place very quickly where your supplement cabinet overfloweth and you don't even know what you're taking stuff for anymore, or specifically you don't know how to measure if it's working. And to compare it to Western medicine, which many of you are more familiar with, right, is they will give you hormones and tell you to inject this every day for this many days, and then come back and we're going to run your progesterone, for example, right? And we're going to see where your level's at. It's very cut and dry. It's very like, take this for this long, this is a dose, and then we're going to measure it with this blood test again. Very simple. And it's easy to understand. I don't do that method because to me that's not very helpful. I'm looking at things like, why would your progesterone be low, and what do we already know from the clues your body is giving us that already told me why your progesterone is probably low, and we're already working to correct that. So that's not how we do it, but it is at least giving you very clear data on one lab marker that you are chasing. So when we remove that part of the picture from how we do fertility work, I know I have to give you back a lot of certainty in other ways, right? I have to give you a lot of ways that you can measure change and that you can clearly see improvement. And really overall, I see that a lot. I see that in all of the members of our group who are doing my Cultivate Fertility Program, for example, especially once they're doing my program. Even just guests in the group, though, they start looking around in the womb room and they're like, oh, I could eat that and drink that, and that could help me because it looks like I have that imbalance. And then they do that for a couple of weeks and they're already in the group saying like, oh my gosh, I didn't know my stool is supposed to be formed. I don't have bloating anymore. Or, oh, I just had my period today and I didn't have cramps for the first time. There are going to be a ton of ways that your body is showing you that what you're doing, that the changes are impacting you. There are more like clinical ways that I will use, like looking at someone's tongue. So when I look at your tongue, I can see if the red dots have disappeared from up the sides. That means that your liver is not hot anymore. You're not flaring heat into the liver anymore. That's great. That means that some of the things we've been doing to calm your nervous system are working. That means that some of the things we've been doing to clear some heat or to cool some heat that's been so fiery and waking you up and giving you anxiety and making you bleed sooner than you should each month. These are things that are telling us that it's working, right? So I like that you can get monthly feedback from your period and your cycle in total. That's a huge way that I'll teach you to measure your progress and to be able to very clearly and certainly see things are different. Like I have always had a 39-day cycle, and after implementing these things for just the 1 month, my cycle came on day 29. Okay, right? That's a hugely certain message that your body is like, A, receiving what you're doing, and B, liking what you're doing. So that's a big confirmation and affirmation that we nailed it, right? We were able to identify your pattern of imbalance, and that then we can easily, using Eastern medicine, easily say, okay, well then these are the things that you should do, and these are the things you should avoid doing to help your body resolve that pattern of imbalance that's blocking or messing with your fertility and reproductive health. So I will give you things that you will learn that will become second nature, like tracking tracking your cycle in different ways than you're used to. So it doesn't have to look like peeing on sticks or measuring your cervix position with your fingers. I don't really push for those types of things. You can if you want. But just looking at how you feel through the month. Do you feel more energetic and more outgoing and more outspoken during the most yang time of the month, which is your ovulatory phase? Do you feel more quiet and more introverted and more like staying home and doing things quietly and privately and alone during your period? Those are good signs, right? That your body is acclimating to a natural flow. Maybe you didn't notice any of these things before, and now just simply by being told what to look for, you can see all these things that your body is doing to give you the feedback. Maybe a lot of it was there all along. You just didn't know to look for it, or you didn't know that it related specifically to a pattern of imbalance or resolving that pattern of imbalance. So there's a ton more information on fertile cycles specifically, and how to look at your cycle and how to live with your cycle more in harmony throughout the different phases of that cycle. And it's not seed cycling. It's really much more about what you're feeling and learning from your cycle and from yourself and your emotional health and your sleep and your attitudes and energy levels, and seeing how those things kind of flow for you for the month. That's going to be very important data. But the wins that people are coming into the group with, that they share, that tell them, oh my gosh, this is working. In stage 1, we work a lot with wind and wind heat, which is basically like your inflammation, your autoimmune conditions too, allergies. So I've had people come in and say, like, I've been doing this for a few weeks and my allergies are gone. I've had allergies my whole life and they're gone. I have people come in with really bad skin conditions, and after just working through stage 1 initially for a few weeks, they're like, my skin is completely calm. Like, I don't have rashes anymore for the first time. There's really clear things that you're going to notice pretty quickly, right? Within a couple of weeks, where you're like, oh, I didn't know my stool was supposed to be formed. That's a huge one. I just thought loose stool was normal, or I thought it was normal to be bloated after my meals, and now I don't have that anymore. These are very quick signs from your body that you got your pattern of imbalance figured out, and you're doing the things that you need to do to give your body exactly what it needs. You're no longer wasting your time trying general tips, because we've honed in on what your body needs and wants, and that's what you're doing. So you know that everything that you're doing actually matters, and you know that what you're doing is making a change for the better for you. And it doesn't have to just be wait until I get my positive pregnancy test. That's not the only objective that we can use to measure or to provide certainty that what you're doing is working. There are so many little measures along the way, not just from a monthly cycle. There's tons of data there, of course, that will change each month for you once you start working through the program. But even faster than that. So I can see changes on people's tongues in just a few days sometimes. So you'll feel different. I will objectively see differences on your tongue, and even looking at other things about your face. When you send me the update pictures in the group, that will help me, but you will notice so many more things than that. You will notice changes in your moods, your energy, your digestion, your sleep, even before you notice a monthly cycle and the changes and benefits that you're seeing there.